If you're someone suffering with rheumatoid arthritis, constant flare-ups, swollen joints, it just seemingly is not getting looser, where you're noticing that the joints that you have are progressing and just deteriorating, there's hope for you. I've been practicing now for 27 years, and our full intention here is to help people without drugs, injections, and surgeries with the most advanced holistic and alternative methods. So we're about to have a conversation about this so that we can educate you on what's possible in your body and how your body actually should be healing itself and why it's not healing itself. I think you're going to enjoy it.
Today I'm here with Dr. Chris Cormier, and we're going to be talking about rheumatoid arthritis. Good afternoon, Dr. Cormier. When people come to you with rheumatoid arthritis, what do they say hasn't made sense about their diagnosis or progression?
So they've typically seen multiple doctors and are just kind of confused. And really, I would say they're not necessarily confused. They think it's a permanent condition that they're going to have for the rest of their life.
At that stage, what are they most afraid of hearing or not hearing from another specialist?
Yeah, kind of that it's permanent and it's not going to go away. That they're going to be on medications for the rest of their life. That they're going to lose function in the joints and not be able to do the things they want to do. If it's in the hand, they won't be able to, throw a baseball or use the remote or, use a hair dryer, all the things, maybe even drive, right? There's so many limiting things you can do. And if it's in the feet or legs or wherever in the hips, then they're going to lose function with those joints and not be able to walk and do all the things they want to do.
Why does rheumatoid arthritis often flare in cycles rather than progress in a straight line?
Yeah, so the cells in the body, right? This goes back to the 30 trillion cells, and it's complicated how we're made, but it's really not when you think of it. We have 30 trillion microscopic little cells, and those cells, they are the health of the cells are dictated by the stresses that you've been through. And so no person is born, just to give you comfort, no person is born with a perfect set of 30 trillion cells. We all have genetic defects. And then from the moment you start living on planet Earth, you have physical stresses, you have emotional stresses, and you have environmental stresses. And those stresses will actually affect the health in your cells, either positively or negatively. It could be anything physical, like a posture and activity, an accident of some type. And then it could be anything emotionally, something small to something big. And then it could be anything environmentally, from the food you're eating to the drinks to the whatever's rubbing through your skin to what you're breathing in. Anything in the environment can knock the health off in those cells. And then the more unhealthy cells you get, it could just start by starting with some unhealthy cells in your hand. And those cells got unhealthy, they lost connectivity, power from your brain. And then those cells, the more they've lost power, they just get more and more unhealthy. And then the body, the way it works is you have healthy cells that start lining up and saying, they get worried about the unhealthy cells and they start attacking the unhealthy cells. And that, in my opinion, is what autoimmune is.
Why does pain and stiffness intensify during stress, emotional strain, or possibly even lack of sleep?
Yeah, so again, the stress that you're going through at any given time can knock the health off in any cell in your body. It's basically like power outages. You want to think of it as this is your power company. It's wired to all these trillions of cells. And let's just talk about joints, because this is rheumatoid arthritis. So it's wired. This brain of yours is wired to every tiny cell in a joint, in the bones, muscles, everything around that, all the cells that are there. It's wired to all those cells, which is crazy to think about how we're God made. But those anything that loses power, those cells will get weaker and they get more vulnerable to these types of conditions.
Many patients are told the disease is under control. Why doesn't the body behave that way?
So the body is designed to heal itself. Big pharmaceutical companies want you to think, hey, I have rheumatoid arthritis, and I'm on the prescribed medications and it's under control. But what that means is the symptoms are just temporarily going away, but the root cause of the problem is going to stay there for the rest of your life unless you fix it. And that'll potentially turn into something else, because we see this condition lead to others if you don't fix it.
What early warning signs of nervous system overload are commonly dismissed as just RA?
Just general aches and pains. When a cell, any cell in your body, loses its health, it'll start crying out. And one of the things it'll give you is maybe discomfort or pain, aching, some burning, whatever the symptom is, aching, burning, throbbing, stabbing, could be any symptom in any part of your body that starts. And that's like a cell crying out saying, hey, I've lost power from the brain. Hey, I'm not healthy. Maybe I've lost oxygen, which is the number one ingredient. Maybe I'm not hydrated properly. I've lost some nutrients. And unless you get those cells, their power back from the brain and those ingredients back, they'll stay more and more unhealthy and progress into other things.
You see patients with many different conditions. When someone with rheumatoid arthritis walks into your clinic, what do you notice immediately that imaging and labs never capture?
Yes, so what we do when they come for the first visit, we look at the body holistically. So we try to take a whole body approach. And not only that, but we want to know what that person's been through. So the first thing we'll do is we'll do a full history and get to know that person. But we want to see all the emotional stresses they've gone through, all the physical stresses they've gone through, all the environmental stresses that they've been had problems with. And then once we go through those, then we actually do a very detailed neurological exam to find all these hidden power outages. You want to think of it like trip breakers in a breaker box. So the brain's here, the spinal cord goes down. Off the spinal cord starting up here, there's 88 primary nerves, and they're like big giant power lines, and those big giant power lines branch all the way to microscopic lines that go to every cell. It's unbelievable how we're made in the nervous system. And so those cells, the more disconnects they get, then the more problems happen. So we start out trying to spark up the brain and make the brain literally send out power through each one of those 88 nerves, and we find exactly where the cells have lost power. And the typical patient coming to see us on the first visit is around 30% out of 100.
Why does the nervous system remain locked in defense even when the inflammation may be reduced?
So the nervous system, remember, is your power company, and it's one of those things where you have two sides of it, right? So if it's got too many unhealthy cells in the body, it'll stay more in what's called sympathetic, which is fight or flight, anxiety, worried, fearful, surviving side of your nervous system, versus parasympathetic, which is healing, calming, relaxing, digestive in the body. So we gotta, in these cases, we have to boost up that parasympathetic side of the nervous system and get it to heal, because otherwise it'll stay sympathetic, where it just stays worried and fearful and surviving.
Why does the body react before logic, reassurance, or medication adjustments can take effect?
Yeah, so Big Pharma does not want you to know that your body heals itself. They want you to believe that your body just needs a pill, and it's deficient in whatever condition you have. If it's rheumatoid, you're deficient in this medication, and you're going to need that medication for the rest of your life to keep that tank full in your body. But realistically, your body is designed to heal itself. They don't want you to know that God designed your body to heal itself. So if you do the right things, if you add the right ingredients and you're able to go to somebody like us to find where those cells are unhealthy and get those cells connected back to the brain, get the oxygen back to the brain, to those cells, get the nutrients back, get the water back, those cells can actually spark up and get healthy again, and this condition can go away.
To go off of that, what actually changes when RA-affected nervous systems begin to feel safe?
Our patients feel so much better. Their joints move. They have much less inflammation, and they start to have confidence back in their body again. Like, my body's actually healing again, and they start to realize that maybe this is not a permanent condition. maybe I can get over this, and certainly you can. That's how powerful our bodies are made.
Amazing. Rheumatoid arthritis is labeled as an autoimmune disease. How often is that label describing what is actually happening and why?
So the autoimmune part of it, as we talked about, I think differently in autoimmune. I feel like it's a protection. Autoimmune's protection in the body. It's the healthy cells trying to attack the unhealthy cells. And so the way we go about it is not suppressing the immune system like conventional does. We actually go after those unhealthy cells. We try to track where those are in the body, and try to get those the power restored and the connectivity, especially the connectivity from the brain, to get back to those cells.
In your experience, how often is immune attack a downstream effect of prolonged nervous system deregulation?
Yeah, so the nervous system, because it controls everything, right? It powers up everything. If the body has too many unhealthy cells, then of course there's going to be some alarm. The more disconnected cells you have from your brain, well, those cells, they're not healthy anymore. So that can potentially spark up this immune response to be able to kill them off. And so that's where instead of suppressing that immune system thing, we're trying to just get that number of unhealthy cells down to where the body doesn't have to go into that immune response anymore.
What happens when rheumatoid arthritis is treated only as immune aggression instead of a system stuck in threat?
Yeah, so from the medical conventional side, suppressing the immune system, as I mentioned before, I don't feel is the right way for this condition at all. And that's what they do with a lot of the meds. When you're on when the immune system is suppressed, I mean, you can imagine it should be there for your defense. And there's a lot to protect you from on a daily basis. I mean, colds, flus, bacterias, fungus, parasites, there's so much in today's world. So suppressing your immune system suppresses it to everything. So from our perspective, we really prefer to work on the root of the problem, not just temporarily fix the symptom.
Why can long-term suppression calm markers while the body continues to deteriorate?
Yeah, of course, long-term immune system suppression can cause many problems in people, and it almost feeds more and more drugs if you think about it. So from our perspective, we're trying our hardest here, and I got to mention, I can't tell you to take meds or not take meds. That's not my jurisdiction. But where we are, most people coming to see us really don't want them in the first place, and they really don't see like that they're giving them any long-term relief, and they want to get off of the dependence, or they want to not have the dependence on it. So we're more on that side.
You work with frequency-based therapies in rheumatoid arthritis and other autoimmune labeled cases. What is the body responding to? Yeah,
so frequency is so cool. I always talk about this, but Einstein talked about it in the early 1900s and said frequency is going to be the future of medicine. He was absolutely right. So frequency, I want you to think about it. Every cell in your body, we can talk about this joint, well, the cells in this joint have a different frequency than the cells in this joint. That kind of crazy to think about? Yeah. So the cells in your heart have a different frequency than the cells in your gallbladder. I mean, so cells in your body need to stay tuned up and need to keep their high the frequency they should have. If the frequency is off like a guitar string, then those cells can't perform. They can't do their job. So nowadays for many years we've been using frequency, but now we have pocket-sized devices. So you can literally use this pocket size, because we not only want to help our patients in the clinic with all the amazing technologies we have, we want to help them at home. Yes. So nowadays we have these little devices that you can put in your pocket. There's settings for pain and inflammation, all kinds of things, and it'll target the cells that are inflamed and actually restore the frequency of those cells. And oftentimes it gets people immediate results. Amazing stuff. So this is, and it's, rheumatoid, depending on how bad it is, requires a corrective plan. So like when people come to see us, I wish I had a magic wand. I could just ding and you'd be, everything would be gone. But it takes us some work. So you can imagine if you come in and you have multiple joints that are bothering you throughout your body, we have to go through a corrective plan, figure out, hey, what do you have how are we going to do this? What are we going to do in the clinic? How are we going to teach you at home? And our best patients go through these types of plans we have, and they learn so much that they don't need us as much in the future, and they feel tremendously better.
Amazing. Why are RA patients often highly reactive to aggressive intervention over time?
Yeah, so these types of patients, of course, are compromised, and where there's so many unhealthy cells in the body that the more unhealthy cells you get, your body it doesn't adapt to major interventions because it's weak. And so we have to take each person and we customize each person. So in other words, some person may come in and they're at this level, right? And somebody else may come in and they're at this level. We want them to be at this level, but we got to do the appropriate interventions to get that nervous system, to get that body, to get those joints to shift to where the body can heal itself.
What happens when the nervous system receives signals it no longer needs to defend against?
Yeah, so the nervous system, remember these cells in the body, when they get more and more unhealthy, it's like the brain is losing connectivity to them, and those cells start crying out that they need help. That's why they give you pain and discomfort and inflammation and all those things. That's how a lot of this starts. It's literally just a disconnect from the power supply. So the cells are weak and they can't do their job. So that's how this disconnect is really, I think people need to be aware, so much more aware of how the body's made, and through the nervous system, how it's connected to all these cells. And these little disconnects, that's what creates all these types of diseases.
Why does regulation matter more than escalation at this stage?
You have to methodically work with this type of condition, and you got to use the right resources, methods, techniques to be able to get it better. And the beautiful part of where we are is we have so much intervention that we can use anything for any patient, and we can change it up if we have to based on results. So all we're trying to get is just results, but we want to methodically take a person maybe that's down here and progressively get them to get to where they're on a healing path of getting better.
We've seen plenty of public figures, including actress Kathleen Turner and Barry Gibbs from the Bee Gees, speak openly about
Bee Gees, yeah.
Bee Gees. I'm not old enough. I guess I didn't watch it. Right. Speak openly about living with rheumatoid arthritis.
Yeah.
Why doesn't success, money, or access prevent severe progression?
It's one of the things that when you're looking for hidden gems, it may be hard to find. It's because they're taking a lot of the information. They want you to buy drugs. That's probably the best way I can say it. The drug companies have so much money that they censor. They actually have, Google will censor certain things and skew people in the direction of buying drugs because they have so much power over this. But they don't want you to know about these hidden gems like we are, where we have all these holistic things that really get results. Because if we had 1 million clinics like I have across the world, we might take so much drug money away that they don't need anymore. And so of course they don't want you to know about what this type of stuff is. It's getting your body to heal itself.
What does that reveal about how misunderstood rheumatoid arthritis really is?
It's a lot, an awful lot, about what the cells are and how they need to be checked and maintained and fixed. But just think of your joints, right? I mean, you got a joint here and it's all swollen and you can't move it and it hurts to touch it. Well, those cells, of course, they're not healthy. I mean, I don't think anybody would deny that, right? So, but instead of like thinking of that joint as, oh, I have rheumatoid arthritis and that's what I have a label and I'm just gonna tattoo it on me and have it for the rest of my life. That's not what this is about. It's literally about unhealthy cells that need to be addressed, and you got to do the right things. It's like a recipe, to get something to taste better. It's like a gumbo that doesn't taste good, and you got to add the right ingredients to get it to taste better.
Yes. In your own clinic, what are some of the most serious or advanced rheumatoid arthritis cases you've seen, and what do they tend to have in common?
We've seen some very young people come to us with it. that literally couldn't barely walk, couldn't function, couldn't even grab like a coffee mug. And after they start coming to see us, they're running. They're drinking coffee mug, whatever. So we're able, and there are some exceptions. Okay, so if this condition, if the joints get so bad that they're not recoverable, well, maybe we don't get full range of motion, but maybe we get 60 or 80% back, where they're able at least to grab a coffee cup, and they couldn't do it before, or write with a pen that they couldn't do before. All these different things when you're normal, you don't think about any of this happening, but when you have this type of condition, everything becomes a challenge. But for us with these types of patients, there's progressive levels that people come in. If they have mild cases, it's very easy. The moderate ones are a little bit more, but we still have very good success. The severe ones, we still have enormous success, but there may be limitations depending on how bad the joints are.
Yes. What do both public and clinical cases expose about the limits of medication-only models?
So basically, we've kind of touched on that already, but I'm going to go through a little bit more. Medications really are just symptom covering things, right? They're not really designed to get to the root of the problem. They're designed for you to stay on it, for you to have a permanent rheumatoid arthritis label, and you need this medication. And if that doesn't help all the way, you need to add some of that medication continuously, or take this medication and suppress the immune system because it's attacking your body. Again, there's so much there that I'm on the other side over here saying your body heals itself. It should be healing itself. It forgot how to heal itself, so let's remind it how to heal itself.
If someone has been told that they have rheumatoid arthritis and possibly another autoimmune condition, what assumptions need to be questioned first?
So they need to first understand that these conditions are not permanent. That's the first thing. With any autoimmune condition like rheumatoid or anything else, they're not permanent. They can be overcome. You just have to do the right things. Don't assume that you're going to have it forever, and it's something that you have a life sentence. It's definitely things that can be reversed. You just got to do the right things.
What keeps you working with advanced RA cases? Others quietly manage but don't resolve.
Yes, so those types of cases, as I mentioned, the really advanced ones require longer term care, and it's so fun for us because we literally have a method of restoring power, checking and restoring power from the nervous system to cells. And so people come to see us and they'll have a 10 out of 10, and we can get that 10 out of 10 to go to 5 or less every single visit, real time, just by restoring power from the brain to those cells. So it's so powerful. It's not like seeing any other doctor. Every visit people come to see us, they get results.
That's definitely different than what they're used to, I'm sure. What is the most damaging sentence a rheumatoid arthritis patient can hear early in their journey? Yeah,
it's permanent. That I'm going to have it for the rest of my life. It's tattooed on my body. I'm going to forever need medications, and I'm not going to be able to use my joints, and I'm not going to be able to walk. I'm not going to be able to do all the things I want to do on a day-to-day basis. But that's definitely not what they need to understand. There's hope.
Yes.
There's hope, and there's possibilities, but you got to do the right things. You have to use the right resources. I always say God will provide the resources for us. You just have to use the right resources, and I feel like that's what we have here.
Awesome. Well, thank you, Dr. Cormier. That was a very informative conversation. I have to go watch BGs.
If you enjoyed this conversation and you feel as though I was speaking to you, and you really want some help, and you're open-minded enough to realize that there are things out there that maybe you just weren't aware of. Well, we have BodyChargers that we created, which is an online program that can help you with from home with all of our devices, methods, techniques, and it's plenty of things you've probably never used and never heard before, but all of it has scientific merit. And so if you want to take things a little deeper, you're welcome to come over to the Nerve Health Institute, and this is something we can definitely help you with. We really love what we're doing so much because it gets you results, and it gets you results every visit in a way you've never experienced before. So we'd be so happy to help in any capacity. And keep in mind, rheumatoid arthritis is a very popular condition, so we can only accept so many a month, but we'd love to help you.